Attention Deficit Hyperactivity Disorder, ADHD, has always been associated to children's developmental problems. However, in the U.S. alone, WebMD.com states there are about 8 million adults with this problem, and some of them still remain undiagnosed and thus untreated. The onset of adult ADHD may have started off in childhood. About 60% of children with ADHD bring the symptoms into adulthood. However, in some cases, symptoms only manifest during adulthood and are not as prominent during childhood, or it may be that the symptoms were never diagnosed during the childhood years. The majority of ADHD cases in children are diagnosed in boys rather than girls, but the ratio between male and female ADHD sufferers seem to even out in older people. Adult ADHD is a lifetime condition that, if not treated and managed properly, will only become detrimental to a sufferer's life as the years go on. But the most important thing to bear in mind is that the symptoms do not have to be debilitating. A person can have ADHD all his years but still live a normal, accomplished life. It is a genetically transmitted neuropsychiatric condition and not a disorder. When a person has ADHD, it does not necessarily mean the person will become a lifetime failure. With proper management and mastering the coping techniques, adult ADHD symptoms can be controlled. The key to managing adult ADHD symptoms is to know an individual's strengths and weaknesses and stay in an environment where the patient can thrive. Do things that capture the interest and keep jobs related to those particular things of interest. For instance, when it comes to career options, instead of trying to keep up with the norms of society, wherein everyone's goal is to get into the corporate world, try to explore career options on the visual arts or non-traditional areas of society. Take into consideration the option of freelancing or running a personal business. Keep in mind that doing just one type of treatment and not exploring other options will only do very little to ease the symptoms. But taking several steps, such as medication coupled with regular physical exercises and cognitive exercises, will help to significantly improve symptoms. Above all, one must realize that every adult with ADHD is unique, and thus every treatment should be perfectly tailored according to an individual's needs. The right combination of treatment will yield the greatest result. Patience, perseverance, diligence, and a lot of support will make any ADHD treatment become even more successful.